Yes. No. Did you unmute?
Okay. Good morning. Can everybody hear me? Okay, this is our first joint committee meeting with the House Healthcare Committee and with our first witness of the year, or for us at least. So welcome, Secretary Samuelson. Very nice to see you this morning.
Good morning. It's good to
You're muted, or we are. Something is going wrong.
It's on your end.
You can hear us?
We can't hear you.
We can't hear you.
We can hear you, Secretary.
The one that I touched earlier.
Can you hear me now?
No, that's the speaker for the room.
House Healthcare can hear you.
Afraid to touch.
Okay.
something, have it.
One moment.
Taylor's here.
Taylor, they can't.
Oh, I'm here to fix that.
We can't hear her.
We can't hear her. Okay.
Okay, can you speak again, Secretary Samuelson?
Good morning, everyone.
All right.
Okay, our tech adept committee member just came in, so I appreciate that. So good morning, everyone. My name is Representative Teresa Wood from Waterbury, and we are welcoming Secretary Jenny Samuelson, Secretary of the Agency of Human Services this morning to give us an overview of the Agency of Human Services, one of the state's largest agencies. Secretary Samuelson, because we have some new members and I know that House Healthcare wants to welcome you as well. We'll go around the table here quickly, and then I'm going to shoot it over to Representative Houghton to do just a brief introduction of her committee as well.
Great.
Thank you. You just heard who I am.
Hi, I'm Jessica Brumstiff, and I represent Shelburne and St. George.
Good morning, Representative Taylor Small, representing Winooski.
Good morning, Representative Ray Garofano, representing Essex.
Representative Noah Hyman from South Burlington and Williston.
Representative Kelly Payala, representing Londonderry, Andover, Weston, and Winhull.
Representative James Gregoire, represent Fairfield, Fletcher, and Bakersfield.
Good morning, Representative Dan Noyes, represent Wolcott, Hyde Park, Johnson, and Belvedere.
Hello, Representative Ann Donahue, Northfield and Berlin.
And Representative Dane Whitman from Bennington. Sorry to step out.
And our committee assistant, Lori Morse, is here as well. And but not everybody knows you, so why don't you introduce yourself for the room?
Hi, I'm Rachel Feldman. I am the Chief of Communications and Legislative Affairs in the Secretary's Office of the Agency of Human Services.
Thank you. Welcome, Rachel. Going to pass it over to Representative Houghton.
Great, thank you. Can everyone hear us okay? Good morning. Good morning, Secretary. We're going to do quick introductions. I represent the city of Essex Junction.
I'm Representative Topham McFawn, and I represent Barrytown and a part of Williamstown.
Representative Mari Cordes, Lincoln, Bristol, Moncton, and Starksboro.
Representative Daisy Berbecco, Winooski.
Leslie Goldman, Rockingham, Wyndham 3.
Representative Art Peterson, Clarendon, Wallingford, West Rutland, and part of Rutland Town.
Representative Bobby Farley-Rubio from Barnet, Reigate, and Waterford.
Alan DeMar, representing Enosburg and Montgomery.
Representative Alyssa Black, representing a portion of Essex Town.
And we'll have two committee members who are going to be just a tad late. So we're going to turn it right back over. Oh, and I'm sorry, Claire Neal is our assistant, committee assistant. So we're going to turn it right back over to Representative Wood.
Thank you, Representative Houghton. So welcome, Secretary Samuelson. We're really pleased that you could be with us this morning, and I'm going to turn it over to you. I understand you have some slides. Are you going to be, what's going to happen with the screen share? Okay, Rachel's taking care of that. And committee members, you should be able to find that on your committee webpage as well if you'd like to follow along. So the floor is all yours. And I'm just going to ask if you would like people to hold any questions they might have to the end, or if you, how do you want to handle questions?
I'm happy to take questions as we go through.
Okay, thank you.
Good morning, everyone. Good morning, Chair Houghton and Chair Woods. It's great to see folks. It's been energizing to have to have everyone back in the building. And I apologize for not being able to be there in person today. I'm at the advice of one of my departments, and to be prudent, I decided it was best that I work from home. So I appreciate you taking the time to learn about the Agency of Human Services. For the record, I'm Jenny Samuelson. I'm the secretary here and have been so for the past year. The Agency of Human Services mission is to improve the well-being of Vermonters and protect the most vulnerable. From that, you can hear that means that the breadth of the work that we do ranges from prevention and wellness to ensuring the care and support for Vermonters who often are in crisis. We do that by working with a significant number of community agencies through contracts and partnerships to administer an array of services and programs that are really designed to work across that breadth and body of work. In general, the Agency of Human Services provides direct services, again, through a series of nonprofit organizations and other organizations on the ground. We are dedicated to ensuring the future of Vermonters and to help them achieve and reach their potential. And I think that that's important to recognize, that we're not just here to enroll individuals in programs, but to help them become independent or to become as independent as they can on their own. The values, I think it's important for us to pause and touch on the values of the Agency of Human Services so that you understand the ways that we do our work. First and foremost, we work to be transparent, and that's transparent with the legislature, our constituents, the people that we serve, and the public. We really work through a goal of integrity along with that transparency. And you'll find that the individuals that work for the agency really are dedicated to both serving the people that we serve and also ensuring collaboration among departments and service between them. We approach our work with innovation. Our goal is to recognize that overall the services that we need continue to need to evolve as new needs arise. And through teamwork. And I think that that's an essential part of what we've really brought to the agency over the last 2.5 years during the pandemic, where you've seen us work more collaboratively across silos and departments within the agency, and also across the boundaries of different agencies in state government and with our community partners. Many of our staff could work other places for more money. A lot of their jobs would be a lot easier, but they really come to the table with a sense of dedication that I haven't seen in any of the other work that I've done in my entire career. So to ground you, I believe Representative Wood mentioned that we are the largest agency in state government with a budget across many different fund sources, both federal and state funds, of over $4.7 billion this fiscal year, and approximately just a little over 3,700 employees. We do that across 6 departments within the agency, and I'm going to go through each of those just with a brief description. The first department, many of you are aware of from the last 2 years, is the Vermont Department of Health. They are our public health entity here in Vermont. They focus really on protecting and improving the health of Vermonters. This is where you'll see a lot of our core prevention work come from. They do that in partnership with schools, businesses, and communities through surveillance, education, promoting healthy lifestyles, and protecting and detecting and responding to both disease and injury through environmental factors and infectious disease. We also have the Department of Health, which has, the Department of Mental Health, which has just a little close to 300 employees. They are really targeted at access for effective preventive, early intervention, and mental health treatment to support the needed supports for individuals to live, work, learn, and play fully in their communities with optimal mental health. Their services range from prevention activities to community mental health services for people who need mental health supports, crisis supports and response, intensive residential treatment, secure residential and inpatient hospitalization. This is a department that is a custodial department. They oversee the work of the designated agencies, but they also run and administer Vermont Psychiatric Hospital and which you'll often hear referred to as VPCH or Vermont Psychiatric Hospital, and a therapeutic residence, which is currently housed in Middlesex, but will be moving over to River Valley in Chittenden County a little later this year. They have a range of partnerships with other organizations. Again, I think it's important for folks to recognize that most of what the Department of Mental Health does is administered through a group of community partners, in addition to the Psychiatric Hospital and Vermont Community Residents. We have the Department for Disabilities, Aging, and Independent Living. There are 320 staff members with this department. They focus on working to ensure that people have an opportunity to grow and to live with disabilities with dignity, respect, and independence here in Vermont. They provide, across their department, they provide adult protective services and other adult services, such as a program called Choices for Care, which is a program that ensures home-based services so individuals don't need skilled nursing. They also provide adult day and other services for older Vermonters. They support and care for individuals with developmental disabilities and support people who are blind and visually impaired. They do licensing for long-term care and residential facilities, and they support and assist people who have disabilities with work and employment through a program called Hireability Vermont that you may be familiar with. Like the Department of Mental Health, the Department for Disabilities, Aging, and Independent Living partners closely with the designated agencies and specialized support agencies. They work with long-term care facilities and our area agencies on aging. Our third department is the Department for Children and Families. There are approximately 1,000 employees in this department, so it's one of the largest departments in the state government. They focus on the health and well-being of families. Folks often think of them first and foremost for that, but they also administer economic services and support programs. And their Child Development Division is the key conduit to early childhood education in Vermont. So the services that you'll often think of for them are the child protective services like foster care and other protective services, but they also administer programs like the 3 Squares program, fuel assistance, emergency housing, which you'll also heard and may know as the General Housing Assistance Program or the Hotel Voucher Program. They support shelters and local offices of economic opportunity. They determine the eligibility for disability services. They administer programs around child support and licensing for child care programs, and they determine the eligibility and administer the child care subsidy program. So, many people think of them primarily in their family services division, but they have a breadth of other economic services programs. The fourth department is the Department for Vermont Health Access. They have about 374 employees. Their mission is to improve the health of Vermonters, health and well-being of Vermonters by providing them with access to high quality and cost-effective health care. Most people will think of DVHA and their role as Medicaid, and often you'll hear them simultaneously referred to as Medicaid. But I want to note that the role of DAIL, DMH, and DCF, so the three departments we've already heard about, so Disabilities, Aging, and Independent Living, Mental Health, and Department for Children and Families, in administering the Medicaid program for older adults, children, and families, and for individuals who need mental health supports. That said, DVHA plays a prominent role in health insurance in Vermont. They help Vermonters access health insurance by determining eligibility and enrollment for Medicaid, and that's why we often refer to them as Medicaid. They run Vermont Health Connect, which is a place that individuals, it's often referred to as a marketplace, but essentially what that means is it's an opportunity for individuals and small businesses to purchase health insurance, commercial health insurance. They establish rates and pay for healthcare providers for healthcare services under Medicaid, and they design payment models that incentivize value versus volume for the Medicaid program. Corrections, which is our final department that we'll walk through. I think it's important to note that Vermont is unique in having that in the Agency of Human Services. And I want to really point out that speaks to the commitment that Vermont has made in identifying the health and human services needs that often lead to incarceration, such as mental health, substance use, and trauma. and the commitment we have for ensuring that individuals get their treatment and care so that their incarceration is both minimized and they don't return to incarceration. Vermont DOC is committed itself to addressing these issues for those who are incarcerated or on probation and parole, with the goal that through the services and support, individuals will achieve independence and never return to the correctional system. By being embedded in the Agency of Human Services, it provides them with a unique opportunity to partner with the other departments that we've already talked about. And they currently, right now, they serve more than 1,300 people who are incarcerated in 6 correctional facilities across the state, and 5,700 who are being supervised in the community through probation and parole. The last major component of the Agency of Human Services that we often don't talk about until an issue comes up is the Office of Healthcare Reform is within the Secretary's office at the Agency of Human Services. They provide vision, direction, and policy related support to healthcare reform, including how we evolve the ways that we care. And I think that that's really important. It's about transforming the way we care. And in support of that, the way that we pay for care. So oftentimes you'll hear them being identified as the organization that helps to negotiate the waivers that we have with Medicare to help them participate in Vermont's healthcare reform, as well as supporting some of the waivers with Medicaid. Right now, the Office of Healthcare Reform is really focused on 2 main key goals. One is stabilizing the healthcare system following the pandemic. And the second one is really looking towards long-term sustainability of our healthcare system, which is coming out of the pandemic pretty brittle. There are 4 key focus areas that they have narrowed in on that we've really pointed to during the pandemic. One of those is integrated mental health and substance use. The second is long-term care, often referred to as skilled care, which includes supporting our skilled nursing facilities and home health, primary care, and hospitals, recognizing the important role that hospitals play in the health, in our health, but also the economic viability of our communities. So I'm going to pause there. Those are the 6 departments and the main office before we go into kind of the key roles and the key focus areas and priorities of the agency. I do want to note, though, that what you should have, part of what you may have taken away is that Vermont, the Agency of Human Services, while it has many roles, what we talked about that are key roles is really as the Medicaid administrator for the state of Vermont, which Medicaid is a health insurance. You often talk about how it pays for many things, but it's really to be the administrator for that, and that crosses multiple departments in the agency. It's also assessing what's necessary for population health, both looking at what are the health and human services needs across the population of Vermont, and ensuring that that's provided not just for Medicaid recipients, but that the systems are adequate for all Vermonters. So those are 2 kind of key roles that the agency plays. And pause there.
Thank you, Secretary Samuelson. I think what I'm going to do is just check around the room here, see if there are any questions before you go on, and then I'll throw it over to Rep. Houghton to see if there's any questions in our sister committee. So I'm just going to.
Can I just ask a quick question?
Yes, Representative Brumsted.
I just have a quick question about the Secretary's office and what's inside of the Secretary's office. And you talked about the Office of Healthcare Reform, but also I wondered about the prevention officer and how, is that an office similar, or is that something, how do you look at that? Like, how does that fit in?
For the prevention officer, I think that you're speaking of Monica Hutt's position, which is actually in the governor's office, Representative Brumsted.
Okay.
There are a few other things that are in the central office at the Secretary's office. You will see that we have in the central office, the Office for Refugee Resettlement or the refugee programs. We also have support for housing, a housing director position that oversees the work of the housing, which crosses multiple departments within the Agency of Human Services. And so there are a couple of other elements there. The The budget for the Agency of Human Services is administered as one budget. There are individual department budgets, particularly this year, we really work to see it as an agency budget. And so the agency has the chief financial officer that oversees the broad budget with liaisons in each one of the departments.
Thank you. Thank you. Yes, Representative Hyman.
Hi, Representative Hyman. You mentioned in the Department of Mental Health, you have just over 300 employees. I was wondering how many of those employees are clinically trained or practicing therapists or psychiatrists?
So I'm not going to have the exact number of how many are clinically trained. I definitely know that the Department of Mental Health will be in your committee a number of times, so I can both get you that information and will invite them over the legislative session to really you to become familiar. That said, the Department of Mental Health has a significant number of clinicians. They have a children's medical director and an adult medical director, both of who are trained in psychiatry. The commissioner and the deputy commissioner are also both clinically trained. All the staff at VPCH are trained at multiple levels in clinical mental health services, as are many of the other staff throughout the agency. So this is one of our agencies who have more clinical staff than just about any of our other departments. But the specific number I can either get back to you or invite you to have the Department of Mental Health come in.
Representative Hyman, we have a few more people, and then Secretary Samuelson has a limited amount of time. Representative Garofano, Representative Noyes, and then I'm going to shoot it over to Representative Houghton.
Thank you. Nice to see you, Secretary Samuelson. I wonder if we could speak to the rationale about moving the Director of Trauma Prevention and Resilience from the Secretary's office to Department of Mental Health.
Yeah, that's a great question. So the Director of Trauma and Resilience still works across the entirety of the agency. They have a broad breadth of roles, similar to what you would see the Office of Economic Opportunity with shelters and other systems, which is in DCF. What we found is that position lends itself well to being housed with other clinicians and who are striving to support trauma and resilience. And so for that position, while it continues to have strong connections in the Secretary's office, and we support its work across the entirety of the agency, it feels for the folks who have been in that position, it feels like they get more clinical support and peer support by being within the agency within the Department of Mental Health. And so we found that model has worked really well.
Representative Noyes.
Thank you, Secretary Samuelson, for your report today. I heard you mention adult days, and I hope we can work together this session to make sure that the ones that closed are able to reopen and that they're supported and are strong for the communities they provide the service to this session.
Yeah, we look forward to working with you. I think what you will hear and find is, going back to what I said about the health and human services system, is that right now that there is a significant amount of financial strain among many of those organizations, and that comes from workforce. A lot of that pressure is workforce pressures. So we look forward to working on both the workforce pressures and the financial issues, which, given the demographics of the state of Vermont, may mean that we need to begin to contemplate doing our work differently than we've done it over the last decade or more.
Thank you. Thank you, members. Representative Houghton.
Great, thank you. Representative Peterson?
Yes, Secretary Samuelson, thank you for your report. I'm wondering how much of the 4.7 billion is part of our state budget of the 8.3 billion. You have that figure. You said it was a partnership between state and federal. I wonder how much is state.
How much is GF? It's just a little. It's a little of general fund. It's a little over $1 million.
$1 million?
Yep, Sorry, 1 billion.
Right.
Sorry, 1
$1 billion.
Sorry about that. Add a
few zeros off. Okay, no, that's fine.
I believe it's 1.2 to be exact. Let me just pull
No,
up.
it doesn't have to be exact. I understand that. That's fine. And you mentioned many of the partners that you work with. I assume the number of employees that the 3,761 positions do not include the DAs and all the other folks. It's just people that work for the state, correct?
That is correct. I think that's a key point that I want to make sure everyone understands. The Agency of the Health and Human Services, and one of the commitments Vermont has made is really to work closely with community agencies and organizations. And so much of the work that we do is done through those community agencies and organizations. Designated agencies are some of them, our hospitals, our long-term care facilities, many other our community residences across the state. Many other organizations do the clinical work and do the community work of the Agency of Human Services. So it really is an agency that while we have a large footprint in terms of our employees, we have an even larger footprint of the number of folks who are doing this work across the state through those organizations.
Thank you.
Any other questions?
I just have a follow-up on Representative Pearson's question. Secretary, you'd mentioned that approximately 1 billion was from the general fund. Am I correct in my assumption that the rest of that 3.7 billion would therefore be federal dollars, or is that coming from somewhere else, that 3.7?
It's coming from multiple different fund sources, and over the next couple of weeks, we'll be walking through the budget and BAA, and so you can get into more details there. I did confirm it's 1.1 billion that comes out of the general fund.
Thank you very much, Secretary.
Thank you. Okay, I think we're good.
Okay, Secretary Samuelson, you still have some additional information to share with us, so we'll hold any remainder questions till the end. So why don't you continue?
Great. So I appreciate the questions. It helps for better dialogue and understanding. So I wanted to walk through some of the priorities of the Agency of Human Services. And these are going to be a very, very high level priorities and pressures that you will see focus both our focus in terms of our policy agendas for this next year. Really, we are working to strengthen and integrate the system of care for mental health and substance use disorder. It's a high priority for us, both for the treatment of Vermonters and for the health of our communities. We're also working to make sure that the human service system works for individuals who need the highest level of care. What we know is that many of the families and individuals that we serve have very complex psychosocial lives. And so what you see is that as they begin to enroll in multiple different programs, when they hit moments of crisis, that it becomes challenging at times for them to negotiate the systems. And so you will see us both working at aligning programmatic boundaries, also using information technology through integrated eligibility and others to align eligibility and applications so individuals aren't giving multiple information. And then also working to make sure that our payment systems allow for alignment across programs, which often means, as we noted before, we get significant federal funds, braiding and blending funding. We're also working to stabilize our health and human services systems following the pandemic while continuing to pursue our long-term healthcare reform goals. You heard me touch on the fact that we're working in two lanes, both on stability and sustainability here, really evaluating what services are needed at the state, regional, and local level due to some of our workforce, some financial pressures, really looking at how we're going to do our care effectively and efficiently across our systems. We have some key known pressures that will come up in each of your committees. Our system of care for individuals with developmental disabilities, they are currently working on an update to the plan there. But in addition, as we come out of the pandemic, we're seeing more individuals at higher level acuity than we've ever seen before with developmental disabilities. And so really working to shore that system up. Related to facilities, we continue to work on the women's correctional facility. We are working to move forward on multiple prongs for a high-end use system of care for facilities to provide stability and treatment there. And then in addition to that, we're seeing more individuals come into our system, not necessarily on the correction side, but who are involved with the judicial system and need either a hospital level of care or a residential level of care. You'll hear the term forensics. And I know for some folks that can be a touch point, but that we're really looking at what it looks like to provide the appropriate care and support for those individuals who may not be competent or determined to be competent to understand the judicial process. So those are some key pressures. And then lastly, housing continues to be a key pressure for the agency as we work with our community partners to both ensure the continued investments in our long-term housing proposals. We've had historic investments there, while also working with our community partners to shore up our shelter and emergency housing system as we come out of the pandemic. So those are key pressures that the agency is feeling. I generally get the question, and I can pause for questions in a minute, but when to contact the central office versus departments in the Agency of Human Services. Typically constituent services, if you are getting press and communication inquiries that cross multiple departments, healthcare and blueprint questions, multi-department inquiries, and broad agency-wide budget questions should come to the central office, whereas many of the other questions that are program specific or are about specific individuals enrolling in specific programs should go out to our local departments. When reaching out, if you're asking yourself who to contact, I'm always happy to speak with legislators, but you'll probably get a much more quick response and targeted to the right person by reaching out to Shayla Livingston, who is our agency's policy director, and or one of our administrative coordinators, Ashley Roy. They typically can triage things immediately in the moment, whereas sometimes I'm always happy to speak with legislators. It may take me to the end of the day to respond. So that's a general overview of the Agency of Human Services. I know I've got to head down to Senate Health and Welfare in just a second, but wanted to make sure to see if you had any additional questions or comments before I go.
Thank you. Thank you, Secretary Samuelson. I just want to throw it over to House Healthcare, and then I'll wrap up if you want to throw it back, Lori.
Great, thank you. We do have one question.
Thank you for coming in, Madam Secretary. In your list of priorities, you talk about making health and human service systems work for individuals who have the highest levels of need. In DEVA, there's a position for a physician, and that physician makes decisions in terms of whether people receive services or not. Is that position filled now?
I believe that you're speaking about the medical director position in DEVA, which determines eligibility for Medicaid medical services. And yes, that position is currently filled.
I'm sorry, I didn't hear what you said.
Yes, that position is filled.
Did it just get filled?
Within the last several months, yes.
Okay, thank you.
Great, thank you. Putting it back to you, Representative Wood.
Thank you. We'll just wrap up here because I know that you need to move on. I just want to leave you with a couple of thoughts, Secretary Samuelson. You spoke about the vulnerability of the individuals that you serve, and likewise, I just want to share that every single day in this building and prior to coming in here, I've been hearing from individuals with complex medical needs, complex social needs, complex physical needs, and they are at their wits' end. I received a note yesterday from somebody who's actually moving out of state because they're not able to get the care that they need here. I'm going to make assumptions that you know about these things, but I felt like I needed to wrap up with something that just brings us back to the people that we're serving. And the individuals within the Agency of Human Services, the staff who are, as you pointed out, are among the most dedicated public servants that I've encountered as well. I'm not remiss in sharing that we hear from those folks as well, and the stressors that are on our correctional staff, our folks in DCF in particular. I just want to point out and share with you that those are things that we are hearing about consistently in this building. And we appreciate very much the time you've taken this morning to give us this broad overview. We really look forward to working with you and with the other staff and leaders in the Agency of Human Services. I just want to say that we are really concerned. We're really very concerned about the status of supports and services for Vermonters and the people who are trying to support them, whether it's state staff or whether it's staff in our community partners. And we look forward to trying to work on some solutions with you.
I also look forward to working with each and every one of you as we move through this session, and appreciate your time today. So thank you.
Alrighty, thank you. Okay, I think this will end our joint meeting with House Healthcare. Yes?
Thank you. Thank you,
Okay.
Representative West.
All right.
Yeah, we're good. Thank you.
Thank you.